All right. Hello and welcome everyone to the Uprooting the Structural Drivers of Health Inequities series. We're really glad to have you all here. Today we're going to cover policy solutions for a values-based food system. I'm Nessia Berner-Wong, she, her pronouns, a senior policy analyst at ChangeLab Solutions, and I'll be your moderator today. I want to go over a few quick notes before we get started. First, this event is being recorded and will be posted on the ChangeLab Solutions website within the next week. You all will also receive a follow-up email with a link to the recording once it's ready. The chat function is open, and we do encourage you to share any reactions there or engage with each other. I'll be asking you all some questions during the event, and you can drop your responses there. If you have any questions that you specifically want to submit to a speaker, please use the Q&A function, not the chat. It'll be easier for us to find there. And if you'd like to join us live tweeting during this event, we invite you to use the hashtag Uprooting Inequity. And as we mentioned in the chat, we'd love to meet you all as well. Drop your name, where you're tuning in from, and your affiliation or organization, and what brought you to today's conversation in the chat. I also want to let everyone know that a live transcription option is available for today's session. In your Zoom window, you should see a button that says Live Transcript, picture here on the slide. If you click on that, you have the option to either show or hide subtitles. You can also adjust the font size to your preference under subtitle settings. Our colleague Bernard Lim is helping to ensure all of the tech runs smoothly today. So if you have any technical issues, you can send him a direct note via Zoom. So I'm going to start off by giving a brief overview of ChangeLab if this is your first event with us. ChangeLab works across the nation to advance equitable laws and policies to ensure healthy lives for all. We are an interdisciplinary team of lawyers, planners, policy analysts, public health practitioners, and other professionals who collaborate with community-based organizations, local and state governments, and anchor institutions such as hospitals and universities to create thriving, just communities. Our priority is assisting communities whose residents are at the highest risk for poor health. ChangeLab Solutions' strength lies in using the tools of law and policy in a collaborative, multifaceted, and cross-sectoral way to ensure policy solutions that are both practical for governments, systems, and institutions, and meaningful for the people they are meant to help. ChangeLab also works with changemakers to improve their knowledge and capacity to use law and policy to change systems, policies, and practices to advance health equity. Today's webinar is the 5th installment in our 6-part series, Uprooting the Structural Drivers of Health Inequity. So far, we've discussed the structural drivers of inequity and how government, community organizations, and philanthropy are reimagining their approaches in the context of the pandemic, economic crisis, and a growing movement for racial justice. And from there, we covered equitable enforcement of employment laws, systemic racism in education, and embedding equitable community engagement in decision-making and planning. Today, we'll discuss the roots of racial equity in the food system, how it shows up today, and concrete examples for how to support a values-based and people-centered food system. I'm thrilled to introduce a really incredible group of panelists today. I do want to note that if you saw the marketing before this, that we had Charlotte from North Carolina joining us. She unfortunately couldn't make it today, but we have 2 awesome colleagues of hers joining us, and they'll introduce themselves with the group. So let's start off left to right with Jose.
Good afternoon, everyone. I'm Jose Oliva, he and his pronouns. I'm the campaigns director for the HEAL Food Alliance. HEAL is a national coalition, multi-sector, multiracial. HEAL stands for Health, Environment, Agriculture, and Labor, and that's essentially the 4 sectors that are part of our coalition.
Vinny, I'll pass it off to you.
Hi, good morning, good afternoon. My name is Vinny Yang, pronouns he, him. I'm a community organizer based in San Francisco and founded SF New Deal with a bunch of friends to support small businesses in delivering food relief during COVID-19 here in San Francisco.
Thanks. Go ahead, Karen.
Hello, good afternoon. I'm Karen Bassarab. I'm a senior program officer with the Johns Hopkins Center for a Livable Future. I work primarily on a project called the Food Policy Networks Project. We support a network of 288 cross-sector stakeholder groups that work on local and state food systems policy, and they do that through partnerships and education as well. I'm happy to be here this afternoon.
Thanks, Karen. And I'll pass it off to Abby next.
Hi, everyone. I'm Abby Piner. I'm calling in from North Carolina. I'm project lead for a group called Community Food Strategies. We're a multi-organizational, multiracial group that's supporting food collaboratives across the state to encourage equitable food policies and equitable food systems in North Carolina.
All right, and Lashana.
Hey everybody, I'm Lashana Austria, also in North Carolina, the founder and owner of Kindred Seedlings Farm, also a team member with Community Food Strategies, also ordained faith leader in my community organizer as well. Good to be with you all.
Thank you. I'm super excited for this group and the conversation we're going to have. I just have a few slides that I want to run through first to set the context for our discussion. To start, I want to clarify that shrinking gaps in health outcomes differ from trying to improve public health overall. For example, reducing disparities in diabetes rates versus removing discrimination from the systems and structures that cause disparities in diabetes rates in the first place. It's a complex objective that requires new thinking and new strategies for action. So rather than focusing on reducing the prevalence of any single disease, the challenge is finding ways to eliminate structural discrimination and change the distribution of economic resources, opportunities, and political power. And finding such solutions does require a fundamental shift in how policy is used to promote health. So these 5 fundamental drivers, as you can see on the screen, are forces that create health disparities and are also critical to improving public health overall. For decades, public health's approach to improving health has been to move upstream, that is, to address the root causes of health problems. For example, public health efforts have focused on preventing obesity and heart disease by creating environments that support physical activity and provide access to healthy food. But despite many successes, health outcomes for some populations haven't improved enough. In fact, in some cases, health disparities have increased at alarming rates. So policies and practices at every level of government have created these structural barriers to good health and also do the work of supporting the fundamental drivers of health inequity, as on the screen. But they can also shift the fundamental drivers in service of health equity. And we need to work together to make the shift and alter the systems that keep inequity in place. I won't be going over all of these drivers today. Our conversation will likely touch on many of them, but I'd like to call out 2 of them to start us off. The first is structural discrimination, which operates as a macro level driver that influences the other 4 fundamental drivers. Structural discrimination operates through policies and cultural norms and institutional practices and occurs when a system or systems, rather than individuals, unjustly deny wealth, opportunity, power, or government representation through racism, sexism, ableism, or classism, for example. So something like government food procurement, which is driven by local, state, and federal procurement regulations and policy, it continues to leave out minority-owned businesses, even with the development of minority-owned business programs. And the second driver I wanted to highlight is income inequality and poverty, which occurs when some people or groups experience disparities in income and wealth generation and is tightly tied to structural discrimination. This is critical because wealth determines whether families and communities can access and afford the basic resources and services that people need to lead healthy lives, like food. Laws and policies play a central role in both concentrating wealth among the wealthy and making it difficult for the poor to escape poverty. For example, food and agricultural workers have historically been either left out entirely of worker protection laws or inadequately protected. The food and agriculture sectors largely employ people of color and immigrants, creating another barrier to income and wealth accumulation in communities of colors. The last thing I want to cover is our food system approach and what we mean by values-based and people-centered. The food system provides a unique opportunity to shape the health, environment, social, and economic outcomes of communities, and the fundamental drivers are obviously active within that. The food system is broad-reaching. It's one of the largest industries in terms of employment and a key ingredient in shifting the fundamental drivers to support health equity. Each element of the food system, from production to disposal, influence those outcomes, but that doesn't occur in a vacuum. The way that we approach food systems and the values that we place at the core of our approach drive the activities across the food system supply chain. So a food system that values racial equity and a valued workforce, for example, can help to shape public health overall. Okay, that is enough of me. Let's dive into the conversation. So a thing that I want to start off with, and I think our speakers are going to have a lot to say about, is the history and perpetuation of structural discrimination in the food system. Building off that brief overview of the structural drivers, a critical step towards transforming the food system is acknowledging the history and perpetuation of structural discrimination in the food system. So I'm going to start us off first and ask Jose, with your experience as a national campaigns director at HEAL and long history of food labor work, can you jump us off with a framing of the food system at its roots, sort of where it originated and how this shows up?
Yeah, thanks so much for the question, Nessie. I often feel like that is the neglected question, and people try to get at the outcomes before they realize how the system came to be what it is beforehand, right? And so I think it's a really important step towards getting at the outcomes. We've been pretty clear from the beginning of HEAL that what we are living today is the direct consequence of slavery, of the roots of this food system being in slavery, both because slavery meant that it was free labor for the owners of these plantations, and thus the food that they were producing didn't reflect a fair market price or value. And post-slavery or post-13th Amendment, basically these folks, the owners of the land in the South especially, sought ways to replicate that system of free labor or very cheap labor. And that happened through Jim Crow laws at first, and then after the Great Migration to the North, they sought workers outside of the country, right? So that's when the great importation of the Bracero program of the 1930s happened, right? And then tons of Mexican workers were imported to work in agricultural fields all over the country at a fraction of what you would pay, anyone, right? This also shows up in the structure of our laws. So the Fair Labor Standards Act, which protects workers from child labor, and it also gives us overtime after 40 hours a week, and it sets a minimum wage. Agricultural workers were excluded completely from the Fair Labor Standards Act, which is why migrant workers oftentimes work piece rate instead of for a particular hourly rate. Which is also why we see a lot of child labor still legally allowed in this country in agriculture. And so the history of our racist system is also the reality of our racist system, right? It is not something that we've left in the past somehow. We're living it today. And it shows up not just in agriculture, right? I'm using agriculture as an example, but you can look at restaurants, for instance, right? And say, why do we have something called the tip minimum wage in this country, which currently sits at $2.13 an hour? So if you are a tipped worker in a restaurant, you can be legally paid $2.13 an hour. And that is because that law was also set when the majority of workers in positions that were tipped were Black. And it was a direct anti-Black law that basically allowed for folks who continue to enjoy the ability to pay workers less than the minimum wage, what it is today, right? And I'm not saying that the restaurant owners or the farm owners are racist, right? I'm not saying that they are active bigots, But I am saying that they are benefiting from a racist system and a system that is established in the roots of slavery.
Thank you, Jose. And I'm wondering, LaShawna and Abby, you have a very specific perspective in the state of North Carolina, a traditionally, agricultural state, and leaders of, or conveners of food policy councils who are working on policy in the food system. If you can reflect on what Jose just shared and how that shows up in your work in North Carolina.
Yeah, thank you, Jose, for that really important grounding. I so agree, and we are working more and more with these local coalitions to ground themselves in their own local history for that very same reason. How can we create and encourage policies that work if we don't root ourselves in the reality of how current policies play out connected to history? And a couple of things come up for me specific to North Carolina, but true across the country, in particular in the South. Land loss is such a huge issue, particularly for Black farmers, BIPOC farmers, and just the reality of thinking about building community health and wealth and family wealth, and the reality that land is so critical in the way that our system is structured to do that. And the Pickford versus Glickman case that supported the reality of discrimination from the USDA that caused a lot of land loss. Mr. Pickford, the farmer, was in southeastern North Carolina, and so just echoes to truth across the South, but really here in North Carolina, that story rings really true. And the other thing that comes up, it's not really specific to North Carolina, but when I think about rural communities across the South and really across the country, the other thing that connects to what you say, Jose, that is of interest to me, especially when we think about lack of access to food, is the structures in our communities also tell the history of why different communities, some communities have less access physically to stores, things like highways and railroads. The small town I grew up in, the railroad is a structure in town that is a physical representation of discrimination and segregation that also reflects historical investments in some parts of a community and historical divestments in other parts of a community. And highways have split African-American communities intentionally and really also broken down the ability to continue to build community wealth. So again, those are policies and practices that have played out historically and continue to. So those are things that come up for me as we think about the history and how we have played out with policy and how we might do that moving forward, grounding ourselves in history. What comes up for you, LaShawna?
Yeah, I really appreciate all that's been said so far. Thanks, Jose. Thanks, Abby. I think for me, a few things pop up in the spirit of when I think about my farm and just, cultivating a space and land stewardship. And my tagline is reclaiming land and reclaiming food. And so I think about this idea of being able to reclaim what has historically been stripped from Black people in particular, but lots of other folks as well. And definitely need to name all the things around history that's happened to Native American folks on the soil as well. And so I want to name that. And so when I think about reclaiming land, reclaiming food, in my tradition, there's so much that's happened with the land in regards to Black folks. And Abby's already named, just the being, land being taken, land loss, for Black farmers and Black landowners, and just how to begin to reclaim that. Also, when we think about the history of race, I have to also point out that the story of race in this country is also a story of labor. in this country. And so to really begin to think about labor solidarity, we think about policy, we think about labor, we think about, workers' rights and all those types of things as well. And so bringing all, and, it's really broad, and it's like, oh, well, what's this got to do with food? Well, it's got everything to do with food. It's got everything to do with farming. It's got everything to do with land. And so without the history pieces, and to really be able to go back and name, how this whole racial arrangement began in this country, and be able to see those parallels today and all the policies that have been created, it's really difficult to be able to move forward if we're not able to see that history and see how that connects literally to every system institution in this country. It's all connected, and certainly agriculture is connected as well. I'll stop there.
Vinny or Karen, did you have any thoughts, anything you want to add there?
I just wanted to bring it in from agriculture and labor to the systems of food and nutrition as well, and how those tie in to keep the system continuing to perpetuate. Like Jose brought up in terms of the hourly wage of workers that work in restaurants being $2.19, there's this other system that keeps them going in terms of the federal nutrition programs and benefits that they receive, from food assistance to nutrition assistance. And some of those systems have poverty thresholds that have been set and haven't been adjusted or elevated. The pandemic presented opportunities where those levels and thresholds were elevated, and the restrictions and requirements were loosened because of the special situation. But it kind of brings to light this possibilities of what we can do with policy and transforming it, and the need for those policies, especially around the food and nutrition programs, to change and be altered. In some ways, it's kind of this default where you can pay your workers below minimum wage because they have this other federal kind of safety net that's going to support them. So you just keep them in this situation where they don't want to earn above what they're getting because they are eligible for these systems, and yet you're keeping them at this poverty threshold.
Nasia, I also wanted to add that as much as it's important to recognize the history of our past practices, we also have to translate what we learn from how trauma is transferred from generation to generation, and prevent future violence through policy making. And so I'm really grateful that Karen brought up this temporary lifting of certain poverty thresholds. So much of policy, hunger and poverty are policy choices made at the local, state, and federal level. These are choices that contain certain social constructs within certain areas, geographic areas. And I think it's really important to acknowledge that, the structural racism that continues to evolve in America is evolving more quickly than policy can keep up with. And it really is imperative that everyone at the policy level advance dignity with every choice they make, because we have to interrupt the ways in which policy changes are driving health inequity in our communities.
Yeah, thank you, Vinny. And it's, Karen, all of it is like reminding me of just like the even going back to the origins of nutrition assistance and the sort of tie of then class to race. And, if you need assistance, that means there's been some failure on your part, and how that connects to all the parts of the food system, and that, the restrictions that we put on folks who need, any type of public assistance, but food assistance in particular, and just like the culture and what we bring into food, and what we request of folks who need assistance, without acknowledging that there, as you said, I think, Vinny, that the system has been designed to put them in that place to need to request assistance, that no one goes there willingly. That's just something that we often maybe skip over and go straight to policy solutions without going back and thinking about that. Vinny, I'm wondering if, in addition, you were doing a lot at the start of the pandemic and the spread of COVID-19, of sort of how that began to expose and maybe force some of these conversations and force people to look and see at what was already there, but perhaps we hadn't been looking at or talking about.
Sure. Thank you for that question, Nessia. For those of you on this call, SF New Deal was sort of born in COVID as a rapid response to a financial cliff that we saw with small businesses, which is there was a policy choice to sort of close the economy in support of a public health outcome because of this invisible threat of a virus. Most small businesses, especially food businesses, operate at very low margins. Food businesses are also a bit of an employer of first resort for a lot of undocumented communities. So the restaurant industry relies on over 20% of their workers are technically undocumented. They may or may not have legitimate individual tax ID numbers, but best estimates are about 20% of restaurant workers are undocumented. In California, agricultural workers, their best estimates are about 70% of those workers are undocumented. So we're looking at a significant workforce that we relied on to deliver our material needs for food and meals. And we were sort of saying to them, we need you to keep working to keep our food systems going, but you're a second-class resident of the United States. And so what SF New Deal really worked hard to do was to help support really small business owners who were finding ways to keep their workers employed, while the federal, state, and local governments were figuring out what financial relief would look like for these businesses that whose cash flows were jeopardized. So what COVID also revealed for us was, just to Abby's point, the ways in which we geographically segregate our communities. The areas with the highest concentration of food security were also the areas with the highest cuts in service to public transit. So, when we talk about mobility, financial mobility and economic mobility, we also have to understand and acknowledge and recognize that physical mobility is extremely important for people to exit out of poverty. If they don't have the agency to decide how and where they want to work and how to get to work and how to return home from work, we keep them in this trap of poverty. And so these are a lot of the issues that come up, and we're seeing this in the recovery as municipalities, both rural, suburban, and urban areas, decide to restore public transit access. The restoration of those services are often in the resource-rich communities where there's the highest concentration of commercial business driven by tourism. So, we're really looking at ways in which we exacerbate inequality in service of certain commercial endeavors and priorities that often exclude wage workers.
Thanks, Vinny. I wonder if other folks, I think it comes up a lot in our work, is that there's this sort of constant work to connect the dots. Food, I think we like to think as a big thing that can stand by itself, but it is permanently and inexorably connected to other sectors and other work. I wonder if folks can talk about experiences of connecting those dots and bringing those other things into the conversation, and just sort of pushing that work forward.
Yeah, one of the obvious things, we're hearing it, and we heard it just now in the data that Vinny mentioned, right? But immigration is very linked to the food system. I mentioned earlier, right, that the Bracero program brought Mexican workers in particular, essentially to replace Black workers who were moving north. But that's not the whole story, right? Then that led to a series of immigration bills that essentially permanently made these workers out of status, which is why we're currently in the situation that we're in, where there's over 11 million workers in the US that are undocumented. And it's, unlike what the right will tell you there is no path, right? There's no line to get into to become a citizen of the U.S. You either stay home and starve, essentially, right? Or you come to the U.S. illegally and work. And the jobs that people are doing are exactly what Vinny mentioned, right? They're everything from farm worker to restaurant worker. And then in the middle, right, there's a lot of folks that work in meat packing, warehousing, transportation, largely undocumented immigrants. And people also have this misconception that undocumented immigrants are all from Latin America. And they're not, right? There's definitely a majority of them are from Latin America, but there's a very sizable group of Asian and African and even Eastern European folks who come to this country because there's no path for them at home, right? And so the connection between immigration and the food system is one that I think is it's alive, and and you can see it both on the business end, right, where a lot of the major agribusiness are lobbying the Biden administration for some kind of immigration bill. And you could see it on the worker side, both with labor unions and with just worker advocate folks who are basically agreeing, not on everything, but at least on principle of folks who are here need some kind of legal path to citizenship. So that's just one of those examples. There's multiple more, right? Like literally you can name the issue and it's connected to food somehow.
I think to your question, Nessia, there's a point of like, there isn't a Department of Food Systems that handles all of these issues related to food. We don't have one at the federal level. We don't have one at state levels. We don't have one at local levels. And so there is some need to like bring in all of these voices. Vinny brought up transportation. Jose brought up immigration. There's elements of economics, retail. We've talked a lot about agriculture, bringing all these sectors together because we don't have that overarching kind of department or agency that handles all of these under one roof. And it's a complex system. So with the work that I do at the Center for a Livable Future, we're seeing kind of these local coalitions forming, and I think in North Carolina with Abby's work too, where it's bringing folks together from across the food system, community members, those that are impacted by the food system, to start to have conversations about how do we untangle this complexity, how do we understand it, and what are the solutions, because it's not one size fits all. It's not one size fits all for every jurisdiction, for every community, for every person. But in order to come up with what those solutions are, you need the people that understand the system, that have been impacted by it, to be at that table, to think about how do we change this, how do we transform it, and how do we stick with it to change policy.
Lashana, I assume in like the work you do, the capacity building, the training, just your work as, in agriculture, this comes up a lot. But tell me a bit how you connect the dots, how you bring that, shed light on that and help people make those connections.
Yeah, thanks for the question, Nessia. With community food strategies, it's a variety of ways. I've found that there's no one size fits all solution for communities. Really hearing what folks are struggling with, ways that they're getting at the work with their food policy council. And some of it could be as simple as, hey, we don't have any Black folks around the table. We don't know any people of color. We're all white folks. This is a lot that comes up, just, really keeping it real from my perspective that, oftentimes the conversation is simply, we don't know any folks of color and we're trying to do this work in community with community and we need some help. And so, those conversations are certainly around relationship building and, hey, you got to know your neighbors, you got to get out here and meet folks, and let's not do work on behalf of the community. Let's do work alongside the community and with community and in partnership, because we've seen within this work just a lot of really white saviorism, a lot of, folks just being in community, trying to do things for others, and a lot of charity as well. And so we're really mindful of the ways in which communities have really suffered and really not serve community well. So those conversations are happening, certainly around trainings, with this history of race and racism in our country, and how that affects what we're doing today. So certainly, those things are happening as well. Lots of policy work happening, writing to our legislators, really coalition building happening within food policy councils. And then also, sometimes it's also good to bring in other voices. We read books and articles and do research together, to bring in different voices and different perspectives, because some folks just simply haven't been exposed. And, and so I think my work with community food strategies has been really trying to take a holistic approach to racial equity. It's not a one and done training. We're not going to have a 2-hour workshop and be racially equified. This is not possible. It's an ongoing journey. It's around this relationship building. It's around hearing from community. It's around being with community. And it's also about sharing food together, which was really difficult during COVID-19. But now folks are, starting to gather again. And I just feel like food is just a natural conversation starter. People are, getting back together and sharing meals together and having those difficult conversations. And so I believe, for the work with community food strategies and our work with councils around equity, we try to be in community with folks. We try to be in collaboration with folks, and we try to walk alongside these food policy councils and food practitioners in general to really be thinking about doing this work differently, not making those same mistakes again, and also not necessarily building up a charity structure, but a structure that's going to really uproot white supremacy and racism within our food system and within our communities and everything that we do in the intersections as well. Yeah.
Yeah, I just want to kind of add on to your points there, Lashana, that I think for us, I'm curious if you would agree with this, some of the sort of biggest successes that we have seen and helped support in the last few years with councils that we've worked with are when majority white or all white groups stop the work that they have been up to because of their deepening analysis of equity and racial equity, and really name that and show up to it. I can think of one council that got really close to passing this tax fund to support sustainable agriculture and small farmers in their county. And they walked that out and really asked the question, if we get these dollars, who decides where the money goes? And they found out that the decision-making body is an existing board in their county that is historically all white, and that those funds had historically gone to white farmers and white business owners, and that probably wasn't going to change. And so they chose not to move forward with that work that they had done, and instead really started building coalition and collaboration with a group of BIPOC farmers in the county. So really recognizing, when to stop doing the work and ask the question, who has the power to make decisions about resource flow here, feels really important. That's just one example of, groups deciding to stop doing the work as a positive for us, and a sign that this analysis around equity is sinking in, and that they're asking the questions about where does the power lie, and what does that mean for where resources flow.
That's awesome. And I want to follow this thread of sort of the not the specific strategies, but the resetting or the restructuring and the distribution of power and resources, that's just as an important piece as identifying the policy solution, but how do we restructure it so that that policy solution at the end of the road and the implementation of it once it's passed is successful and does make the transformative change that we're hoping to get. So I'd love to hear folks' experience, either more from Abby and Lashana, I know what you've been doing on your end, or from other folks on what's happening in that space of redistributing and restructuring and resetting.
Nessia, if I may, I think there's a real opportunity in this moment for community members to advocate differently in a budgeting process at the municipal level. There's often a lot of talk about budgets have an inertia of their own. Once you've been budgeted into a municipal budget, you sort of claim that budget to be yours in perpetuity. And I think we really need to reimagine and re-examine how governments determine how tax dollars are spent. Community members need to have more of a say in allocating resources at the local level. For those of you that work at local agencies, you also need to take this moment to leverage the hundreds of millions of dollars on the table right now through the American Rescue Plan for building community capacity and matching your local dollars with federal dollars for community-informed practices and programs that deliver on public health and collective well-being. And so a lot of what's driving these inequities are rules around funding. So for those of you that believe that schools are the proper channel for delivering social services to kids, advocate for universal school meals and remove means testing of meals. So these are different ways in which we can really interrupt the inertia of policy violence that happens that's really invisible because people aren't being killed in a way that's really visible to us. It's a slow death for a lot of community members.
Aaron, Jose?
Yeah, I think the piece that I would lift up here is, I think it might have been Abby that mentioned this around building local coalitions. But it is, so we're leading this work called Good Food Communities. And it's really focused on passing legislation at the local level that makes values-based procurement the policy of that particular school district, municipality, state. And we always start that process by building a local multi-sector coalition led by the people who are most impacted by the ill effects of the food system, right? That's the very first step. And so if you want to think of a recipe of any sort, which I know that, it's not a one size fits all solution, but if you do want to think of it in terms of what do you do first, the first thing is you talk to the people who are most directly impacted, who are focused on specific sectors, right? So you're always going to have folks who are focused on nutrition, right? And how the lunches are not nutritious or not impacting the nutrition of the kids who are eating them. You're always going to have folks who are concerned about the environmental impacts of food, and you're going to have labor unions and other worker advocacy groups. Start with that. Those are your building blocks, right? Those are the folks, and they're in every community. You just have to find them, right? You just have to look for them, and they're there. And in many cases, what we've done is we've helped actually fund some of the groups, right? Like there's a need for a particular sector to be represented in one of these coalitions. So we will invest in that particular sector because we know that that's a necessary component of a full understanding of the food system and how the food system operates and the impacts that the food system has. So that's what I would say, just in terms of like what, how do you begin to address some of these questions? Because I believe to my very core, right, that nothing without us is for us.
I would, I would agree with Jose's comment that you have to have the people that are most impacted by the issues of the food system at the table, because otherwise you're making decisions for them that might not be appropriate or might not fit what their needs are. And with food policy councils, these groups have been around since 1982. So it's been a while. They didn't start to increase in number until 2005, and they're intended to be this vehicle for community engagement in their local food system, building relationships, affecting how programs operate, ultimately with the goal of setting and changing policy. But for a long time, they've been kind of these spaces of professionalization in food systems. So if you work in this arena or sector, you have a seat at the table. They happen during business hours. They're volunteer-based. They have limited funding. And so part of shifting who sits at that table means shifting how they operate, taking a step back from looking at it in terms of these are the problems and we need a fix to them, and really thinking about what are the values that we're coming to the table with, who is a part of this, and how do we kind of start to build relationships and trust with one another so that we can move forward in policy. And this is not, these coalitions and their development isn't something that happens and changes overnight. This is a long game, just like policy is in terms of building trust with one another so that you can make substantial changes in policy.
And Karen, I know you've shared that, you have this network of food policy councils and you're seeing trends in sort of what are the issues rising to the top and sort of what their goals are as councils that has changed over time.
It has. We survey councils once every 12 to 18 months, and we've done this since 2013. And a lot of them, and it still holds true today, that their focus is on healthy food access and making healthy foods more accessible to communities in a variety of means, through citing retail to increasing access to food through farmers markets with use of federal benefits. But over time, we've seen the conversations about how race plays out in the food system and equity and justice play out as well. And so the focus of councils now are these conversations of how do we reset our table? How do we show up as trusted allies with communities? How do we take a step back from this kind of running at what the policy changes need to be to really thinking about who are our partners and how do we show up in community to support them? And so there's a lot of hard conversations that are happening with councils. I recently talked to a group that's in a very conservative state about these conversations about race and equity showing up in their council work. And they're going through a transition from, we have these individuals that are a part of our council that have political influence and money, and they don't want to be a part of these conversations about race. And so their suggestion is, let's just talk about policy at the beginning, and those that want to get into touchy-feely things can do that on the second half of their meeting. So it's this challenge then of, okay, this questioning of, do we need these people to be members if this is the direction that we want to head? And then what does that open us up to? Who does that invite to be a part of our work? And how does that transform our work? And so there is this tension that's happening with councils, but I think ultimately their direction is headed towards, we have this kind of this confronting of how race and systemic issues show up in our food system. And we want to be on the part that's helping to address those and not perpetuating them.
Nessia, I think also it's really important for policymakers to understand and acknowledge that sometimes the tables that are being offered, that seats are being offered at, are not inviting. And so, we can't compel impacted community members to come sit at a table that propagates or perpetuates policy violence. And it may be that, where policies fall short, communities are already delivering interventions that are invisible to a lot of policymakers. And so what COVID also is demanding is that we identify the community interventions that have existed and are serving little pockets of most impacted community members. And we offer resources without a means test or an assessment. A lot of these communities that are closest to harm and closest to need are exhausted from the constant assessments they have to make. The 4-page applications, the 7-hour waits in offices, the surveillance and the supervision from various agencies, sometimes it also means that you have to get up from your table and go just observe and witness and uplift community members who have found a way to build a different table.
Totally. Go ahead, Abby.
I just really appreciate you naming that, Vinny. And I think it brings up for me, it certainly echoes of language that we heard during COVID, community members saying, what I'm most proud of is that we're feeding people without asking them to prove that they're hungry. Like, you don't have to prove anything here. We're just feeding each other. And that is so much of the goal of, I think, the food system we want is communities who can and are feeding each other. And something that's been coming up for us recently is language. When we, one of our main goals when we do racial equity trainings with the Committee on Racial Equity and at Community Food Strategies, one of our main goals is to create shared language so that we can work together to build analysis and dismantle structural racism. But when we think about food access, that's a term that is used often in the work of food systems, and a lot of funds and resources go towards creating food access. And Vinny, I think what you are naming for me resonates with this concept that, first of all, the question is access to what? Access is such a gatekeeper term. And if what we want is to create self-determination and communities that are able to feed ourselves and each other, that's not about access to, that's about opportunity and resources that are available. And so how does our language drive the actions that are correlated to that? And to me, that access piece really comes, echoes of what I would call whiteness or a conversation from the privileged class. And Vinny, your point, just naming the solutions that are already there, and how important it is to have folks who have been creating solutions forever leading and getting resources, the opportunity to make those solutions long-term and not have to spend so much time sort of scrapping for the resources for that. So all of that connects to me to language and the real need to develop a shared language that gets us towards the actions we care about, not just the language that we've been using, which I think maybe doesn't get us to the holistic vision that we talk about wanting to move towards.
Well, one thing that I would add to, I'm sorry, I know I already spoke for this question, but I just want to add this piece. I think funders actually are a big part of the problem here, because let's be honest, we are all part of the nonprofit industrial complex, and as part of that industry, there are industry leaders, and those industry leaders are funders. And they both set the terms and they create the parameters, right? So everything from the competitive nature of applying for a grant to the both the way that you are monitored and then expected to provide a report to folks who are not of that community oftentimes about the things that you're doing in your community, creates the kind of industry standards that the rest of the organizations in the industry are leading with, right? And so, I don't want to point a broad finger because there are a lot of funders now, or maybe not a lot, they're still in the minority, but there are some funders out there who are experimenting with practitioners being on the board of the folks who make the decisions about where the money's going. And I applaud that. I think that's exactly the direction that we have to go, but we need to go further than that, right? We need to really examine both how we are distributing that money and also the standards that we're setting as funders.
I just want to quickly comment. This is such a beautiful conversation. Thanks so much, Vinny and Jose and Abby, for all your comments so far. I think I don't want this to slip by us without just naming, as a community organizer, mutual aid There's just been such a beautiful, brilliant, revolutionary outpour of mutual aids happening within communities, particularly during COVID-19, but it's certainly a model that we can use going forward, particularly when it comes to, all of the questioning and interrogation that we do around folks who need something. And in my community, we started a mutual aid last year. And it turned out to be, a real need for our community and valued within our community. And, we're just thinking about ways to continue to think in terms of abundance, within our respective communities and not what white supremacy teaches us, which is scarcity and lack, that we actually do have abundance. And there's really no need for any community members to be in lack or want, because we really do have the resources we need. So I just wanted to bring that up as a community organizer, that we've really tried to push forward and think about abundance and think about revolutionary ways to be within community together.
I love that. Thank you, Lashana. I think this idea of these, there's new ways of thinking and new models that we get to start over and say, let's think about a whole new way of thinking about this, not of scarcity, but of abundance. I really love this. And I'd love to shift the conversation to that. So what are the new ways that you're seeing? What are the new ways that we can be thinking or modeling to address these issues, to really shift the focus of our system to people, to racial equity, and to a valued workforce and valued communities and just individuals as a whole?
That for me.
Started to jump us off.
Yeah, no doubt. I can jump right in there. Certainly, what I've described in the spirit of mutual aid and abundance. I think one thing that has really impacted us in our communities is this idea of scarcity. This mentality, this way of being and existing, that, there's somehow a lack of resources, that there's a lack of this or a lack of that, and how we start to live this out within our community, how we start to live this out within our food work. It shows up. I call it white supremacy. Some people say the residue of white supremacy and how that affects community. And so beginning to be together and to build relationships, to start living in abundance, to start speaking abundance. It goes back to the language piece that Abby talks about as well. Our language has to shift into abundance in order for us to really be able to experience what I've been doing with one particular food council that I've been working with here in North Carolina is really trying to get them into the mind of freedom dreaming, and that could be through just a series of exercises. Like, can we just dream? White supremacy has really stifled our imagination. We can't even imagine abundance because we've been in such a mess for such a long time, and so really being able to freedom dream. Let's work that out. What does it look like? What can it look like? What do we imagine in our liberated community where there's no lack of food or resources? And so just beginning to start thinking in that way, beginning to start, shifting our language in that way and really being deep in community. And so, it's a new idea for some folks. Folks are like, I just never imagined this way. I've never thought this way. How can we really begin to see this happen? And so I think I just really believe that our scarcity, lack, not having enough, has been internalized in such a way that we actualize it within our communities, and so the freedom dreaming, the imagining, the deep conversations, the relationship building, having diverse folks at the table. The white imagination has done a lot in this country, and so really being able to imagine with other folks who are deep in community, and particularly, in my context, I'm deeply connected to Native American folks here in my community, and I just want to be able to glean what I can and learn to be able to move forward in ways that are that are more liberating and freeing for all of us. Yeah.
Thanks. And maybe Jose, I know you do from this community and these community dreaming exercises to these critical piece sort of cogs, which are government, which, you know, have been the sort of built the system as is, and of course a critical piece in taking us in the other direction. If you could speak to sort of how you're moving things forward with, you know, government partners that are just a whole different animal to work with, and a lot of us that work in or with, you know, government agencies, you know, it's not easy work.
Yeah, absolutely. So, you know, I make fun of folks who are now using the term values-based procurement because I say we've always had values-based procurement, except the values have always been about what's the cheapest stuff we can find, right? And I know, you know, I get a lot of pushback from my colleagues in the public sector saying, well, it's not just the cheapest, right? It's within the parameters of what's good. But still, right, the value that has driven the purchasing of the food has not been the value, for instance, of a valued workforce, right, or of equity or climate change, right, things that are actual drivers and that our food system perpetuates. So I would say that the best advice that I can give folks who are starting to work with government folks is, first of all, they feel like they're being attacked on all sides. They don't feel like they are your allies unless you let them know that you're their allies. And doing that goes a long way towards a relationship of building that trust that one of the other panelists is talking about, right? We have to be able to develop that relationship with them in order for us to be able to move them in the direction that we want them to go. Now, that being said, right, there's going to be resistance, and understanding what the resistance that they're going to face internally in their whatever department, agency, city council, whatever agency you're working with, understanding that is critical, because that'll get you a much longer sort of return on your investments than just pushing them and making them, you know, trying to make them do what you want them to do. And mind you, I come from the old school organizing school, right, where you build power, and the power that you build is what you use to push people to get them to do what you want them to do. And that still holds true, right? But you have to know their limitations as well, as what I'm saying, right? Understand how far they can go within the system that they're operating in.
To Jose's point, I really appreciate that advice, because we're all human. And I think, you know, it's really easy to sort of segment individuals based on their titles and their roles and how much money they can allocate towards certain causes. But I think, you know, the thread here that I'm feeling from the other panelists is we have an incredible opportunity just to advance dignity for people who are close to harm and close to need. And if there's ever any disagreement around a tactical approach or strategic approach, you can always return to understanding the solution that is the quickest way to advance dignity as a starting off point, even if you don't agree ideologically about, you know, broader concepts. So I would say just remind people that compassion is also a policy choice, and a great place to start when you can't agree about anything else.
Thanks, Benny. And I want to pause and recognize this has been a great conversation. There's been amazing conversation happening in the chat. We're getting some awesome Q&A questions. Also, so many resources. I recommend everyone scroll through the chat. There's I think they could be doing their own panel right now. But it's something that comes up all the time in our conversations, in our work, and folks are bringing it up. The audience members are bringing it up. Is this, and I think it's sort of come back and circled back a few times in our conversation, is, you know, we have been and still are in a very politically challenged environment. So I think that you have two pieces to this: is the how do we talk? How do you engage with either entities or individuals or decision makers about the roots of this issue in order to address it in a way that will be sustainable and transformative, and with folks who don't haven't gone there and maybe don't want to go there? So how do you sort of either start that conversation or, you know, do it in a way to make progress? And then I think also there's this other piece of putting the onus on the communities that have been most affected, and sort of like that balance. And we talked a bit about that before, but I'm going to ask folks if they have any thoughts on that first question of sort of how to navigate these spaces where not everyone's on the same page.
I feel like I talk too much, but I can't help the uncomfortable silence. I would say the term that we use at HEAL is we move at the speed of trust. And so to the extent that we are able to build trust with folks, then we know how far we can push them. And when I use the term push, right, I'm not, I know it sounds semi-violent, right, like we're actually pushing them, but it's really just about understanding that we are in agreement about the direction that we need to move the food system. And then the secondary conversation that flows from that is, what are the steps we need to take to get there, right? If we are in agreement, then what do we need to do to get there? We might not agree on the policies, on the specific elements of the policies, but if we agree on that end goal, then we can develop ways of working towards that goal, right? Even if it's not our way, right? We will find a way.
I think that's great. Thanks, Jose. And also would be great to hear, we talk a lot, I think we've talked a lot about process, and I think that's critical. You know, we can't just put a policy on the table and expect it to either go anywhere or be implemented and make change on the other end, without talking about this policy piece, which includes community engagement, community dream making, civic engagement. But I think it's always fun to hear about policy successes that you've all experienced, just to see what it can look like on the other side of, you know, you've made change, and anything you want to share that, you know, you feel proud of that you've been able to achieve or know of. Maybe I'll make Abby or Lashana go first.
Sure, I can go. Always proud of being in community and with community and thinking about food. And so that's just who I am, being with folks, being in community with folks, even being in the trenches sometimes and doing the difficult work. So definitely proud of, you know, some of the councils that I've worked with and Community Food Strategies has worked with who, you know, starting to really get some of this stuff. And I'm like, look, we really need to calm down. I say simmer down now, you know, just simmer down a little bit, you know, rethink what we're doing, come back at it. And the folks who could just continue to show up for the work, continue to be, I call it being in the struggle, that we're together, that we're struggling together, but we're working alongside each other and trying to do what we can within our community. So certainly proud of that. I'm going to name this because sometimes I think we don't do enough, particularly when we're situated on, you know, beautiful, life-giving teams. I'm proud of being a part of Community Food Strategies. It's just a beautiful coalition, team of folks. We're multiracial and you know, multi-ethnic, multi-gender, just trying to also show up in our communities as a model for what other folks can do and what our food policy councils can be like. And so that gives me a lot of joy. I'm proud of that. Proud of the work that we're doing. And being in community together. I think I'm also proud of the number of Black farmers that I'm starting to see in my respective community. It's just the Black joy is really overwhelming in a good way. Just to see folks coming back to the land and reclaiming land and food and creating, our own tables when there's no table for us. And just really being able to be in community that way. I'm super proud. I'm proud to be a Black farmer, a Black female farmer, a Black Christian female farmer. I mean, all the things I could throw in there, and so it really does give me a lot of joy and a lot of pride to see this work moving forward. For me as an individual, for my community, for community food strategies, for North Carolina, it's all good. Yeah, Abby?
Yeah, I'll just sort of build on that a bit and really appreciate that, Lashana. I think what your conversation sort of drew out for me is that with the groups that we are working with across the state, to me, the folks who are working at the intersection of Black and Brown leadership and economic development around food. So it's often at the micro level. It's like neighborhood level councils that are Black and Brown led, who are about and creating policy with city officials to grow food and sell food for the purposes of feeding their communities and creating some really interesting policies around using existing infrastructure that the city has put in that's being underutilized. And, these communities have exciting, interesting ideas that they're super into that are supporting their communities. And so starting at that micro level is, I think, where we're seeing a lot of traction and that communities are building wealth for themselves with the support of policies as needed to use the physical space in a city to shift zoning. So those are some of the spaces where I am really sort of lit up around the policy piece and how folks in the communities that we're working with are being innovative for the betterment of their own communities and how those examples can then translate to other communities around the state and the country. So that's what I'll add. Oh, and I guess I will also say to the point, this is not, it's back maybe back to your policy piece, Nessia, but I mean process piece, but we have had the ability to do a shared gifting or participatory grant making process with councils across North Carolina. And there, what we hear from the groups that we're able to sort of support through that process is how powerful it is to be able to make the decisions about where funding goes with their peers and to really drive that decision-making is a necessary process piece in policy decision-making and resource decision-making. So that's been a real success that we'd love to see grow in all kinds of ways.
I also want to just add, don't sleep on the youth. The youth organizers in our communities that are working at the nexus of climate justice, land justice, racial justice, queer justice, they're the ones that are really delivering intergenerational education in a way that a lot of us tired organizers can't deliver. These are the ones that are going back to their households and having conversations, uncomfortable conversations that we can't have in traditional organizing strategies. So really, there's an organization in San Francisco here called Poder, and they were able to leverage and organize and gain access to state-owned land. And they now run a farm called Hummingbird Farm that has become quite the model for community-based capacity building, land sovereignty, and climate justice. And so I would say invest in organizing invest in lifting up youth organizers in your communities, and don't be surprised by the wisdom that they bring to the table.
Karen or Jose, any successes that you want to raise up before we wrap up for today?
Sure. One, I just wanted to say thank Vinny for bringing up the youth, because I think that's a really important group that we see rising up. And also, I'm glad Abby brought up shared gifting, because we've seen that happening in a couple of states too, to help fund some of the work of councils. And it's a really wonderful model of bringing community together to decide how wealth gets distributed. But on the policy front, especially at the local level, there's some interesting policies that are coming out of a couple of cities. Indianapolis passed a resolution stating that racism is a public health crisis, which enabled them to also set up a division of community nutrition and food policy that's now responsible for addressing racial inequity. And I think that's important because it's showing that the city has an investment in tackling these issues and recognizing them. And the person that's leading that department is a Black woman. And so it's really grounding it back in the community and really centering equity and race within this notion of how their food system works. And then there's another in Charlottesville, Virginia, there's been an investment in a group to do kind of a community-driven process of figuring out what those challenges are with access to healthy food, and really centering the voices of the community to lead that process, to figure out what that process looks like, and also to come up with the recommendations and solutions. And so with these two groups, you have this government investment and recognition that there are issues with the food system, and some sort of financial investment that's going into the work that's being driven by the community.
Yeah, I applaud all of that. I think it's, we've been working for a little bit of time now to pass these local resolutions and ordinances to make values-based procurement the law. And we've been successful in a bunch of cities and are now moving the fight to the state level in a few states. And I think that's going to be the next frontier, right? And given the reality that we have in Washington, D.C., very divided government, and the fact that the midterm elections seldom go the way of the party in power, that we want to stay focused on state level fights, and knowing that when you build these multi-sector coalitions that are led by the people who are most directly impacted, you can actually have a base that is going to be there for a long time, right? It's not, the victory isn't just passing the GFPP law or whatever, right? The real victory is actually the long-standing stay of that coalition that's going to be there to fight on broader food justice, racial justice, economic justice issues.
Thank you, Jose, and thanks everyone. We're a couple minutes over. This has been an incredible, I had a million questions for our speakers, and I want to thank the audience for being super engaged and asking awesome questions and providing great resources in the chat. That's been really incredible. And thanks, of course, to all of our speakers and to the time they're spending with us and the work that they're doing. I mean, this is the work. So thanks all for joining us. You'll be getting a follow-up email with some resources and recording within the week and contact information for everyone. So that's all we have for y'all today. Thanks for joining, and we hope you join us for our next episode in July on housing. Thanks all.